fall of last year, CCM has endeavored to act upon the report released by Dalio Education on Connecticut's unspoken crisis of at-risk and disconnected youth. Through expert roundtables, we learned that this is not just an urban problem or a rural problem, but one affecting all 169 towns and cities in Connecticut. It inspired us to create the 119K Commission, named after the number of youth who are at risk or disconnected, with the goal of reconnecting these young people with school or careers. We are inviting experts and the public to speak on this critical subject, and we want to share some of what they shared with us with you. To learn more, visit us at 119kcommission.org. The Municipal Voice is the Connecticut Conference of Municipalities podcast in collaboration with WNHH LP 103.5 FM. I'm your host, Matt Ford. As always, be sure to give us a like and let us know what you're thinking in the comments. CCM's Municipal Voice podcast continues to present a key forum on important state and local issues. The views expressed do not necessarily reflect the consensus views of CCM or a member municipal leader. Our first meeting was held Tuesday, March 26th at New Haven's Hill House High School. This meeting focused on the question, who are the 119,000 at-risk or disconnected youths? And to discuss how the system operates.
Thank you very much. My name is Mike Frieda, North Haven's first selectman in the neighboring town. Ms. James, thank you for an outstanding presentation. It gives me a great pleasure to introduce our second speaker, and her name is Lisa Tepper Bates. She is the president and CEO of the United Way of Connecticut. She has over 25 years of experience working in U.S. diplomacy, public policy, and state nonprofit local government. So she is really an expert also. We're delighted to have her. Lisa, welcome.
Thank you so much for having me, and thank you to Andrew Ferguson and Barbara Dalio for their unbelievable work through Dalio Education to help make really clear to all of us the challenge that we have before us with regard to disconnected youth. Thank you also to all of the local officials here and your colleagues who couldn't join you today, but who are all willing to dedicate your time and resources, we hope, and thought to this important problem. I'm from Eastern Connecticut and proudly represented here today by Mayor Passero from New London as well, so glad he's here. Just hoping to provide a few additional thoughts for you today. I think what you'll probably hear more of as we go down the table are very similar thoughts. So much of what LaShante spoke about is going to resonate with what I'd like to share with you as well. And so maybe that's a good thing, because maybe that means we're going to lift up some ideas that start to sound very familiar in the way of those ideas, Mayor Elicker, that you're hoping we surface today. I'm going to speak from my experience with regard to work in homelessness and coordination around homelessness in Connecticut. Some of that work, I would argue, actually speaks to an important gap, LaShante, that you signaled, which is that there is no clear system to re-engage students who've left the school system. When the kids are with you, it was inspiring to hear. You care so much about them, you're there, and you are the center of gravity, trying to build that plan. For the kids who have left the school system, who is that center of gravity? And I'd suggest to you there isn't one right now. And that's an opportunity, right, to figure out how do we build that? How do we create that for the kids who are not right now in the school system? With due respect to all that you do, and I think we just can't put that extra burden just on the school system. I think we need an additional aspect of how we can bring resources together. So could we go to the next slide? Or is that me? Sorry, that's me. I have to do that. Sorry. Great. So I'm going to talk to you about a few things. First off, to discuss with you that systems coordination does work. And it sounds like just a very wonky, vague term, but I'm going to talk with you very concretely about coordination that we built into homelessness and our efforts to end it here in Connecticut and how that worked. A big piece of that is shifting away from a program-by-program approach to thinking first and foremost about putting the consumer in the center, not thinking through my lens as a program that might do very good work in what I do, but thinking about the consumer, and they might need 5 different programs to come together around them. And then again, echoing LaShante, effective systems and data come together, and those can drive the outcomes that we all want to see. And there's evidence for that, and there's a way to get there with regard to disconnected youth. Then I'm going to speak briefly to another work stream that I think dovetails so importantly with the Dahlia work, which is the Campaign for Working Connecticut, which has also worked on this issue of disconnected youth. And part of that is to discuss the process that we hope might be helpful to you to think about. And then we're going to end with just a few thoughts, Mayor Elicker, about what we would like to do, especially from that Campaign for Working Connecticut work, where we would like to suggest you might start. Next slide. That's me again. Sorry. All right. So with regard to the homeless system, before we coordinated, and I think this is probably the experience that a young person who is disconnected would have today, you feel like it's a maze. You're trying to navigate a maze all by yourself to get to that center place, which is a home, stability, maybe the mental health support you need, a job, and it's all up to you to figure it out. Josh, it was heartbreaking hearing your story, and yet I've seen that same story for so many people, right? They can't put it together easily on their own, and yet we expect them to do that, right? We expect them to navigate multiple programs, figure it out, build their path, and get there. With regard to homelessness, what we tried to do in Connecticut and are still pulling together, we said put the client at the center and make the programs come together around them. So start with a person and say, what does this person need? And then pull each of the programs that can provide a piece of that. Pull them to the client and have them work together. And I'd suggest to you, all of you who are funders, make that a requirement of your funding. Whether it's city or state or federal, tell them, if I'm funding you for a piece of it, that's great, and please do that, and you must coordinate with your colleagues who do other pieces. I expect that of you, right? And that's how you can make it work, and bringing the resources together that way will maximize the dollars you do have. And I guarantee you there's not enough. We need more investment, but I would also guarantee you we're not maximizing what we do have, because we're not coordinating those resources as best we could. So just to take this a step further, this chart here shows you that when we brought that coordinated system together, pulled all the resources to the table in Connecticut, we were able to reduce homelessness in our state by about 60% in less than 10 years. There was some new money, but that wasn't really the secret to it. We actually were keeping track of people, one person at a time, and figuring out what each person needed, and then having different programs work together. And so, that works. So I would submit to you, that's a chart right there that tells you this works. So from that, let's talk about what does that system really look like? And I want to be pretty concrete. And again, LaShante, you're just going to nod through this because you talked about a lot of this. The first attribute of a coordinated system is pulling all the stakeholders together into one place, sharing that data, aligning on priorities, sharing goals. Everybody's looking at the same problem, the same way, the same metrics. And so that rolls into the data. Services coordinated, again, have everybody working from the same sheet of music around the person. Also having a willingness in a system to really be careful to know what works and what doesn't, what you have and what you don't have. And there may be some things you've done for a long time, but maybe they don't really work. So be bold enough to say, stop doing what doesn't work, invest more in what does work. Willing to listen to the voices of those who are affected, the people with life experience, so important. You can't plan a system, you can't take those steps needed unless you're listening to the families or to that young person. They have to be part of building the system. And finally, it's really important to understand coordination doesn't happen by itself. You do have to invest in it. It is its own work. And so just understand that and be ready for that. So application to the 119 campaign, 119K campaign. Just want to frame this out, understanding that opportunity youth or disconnected youth, They are ready to strive for success. They want success. They want stability. But we need to understand that they are trying to piece it together, living in these chasms, getting lost along the way. We also need to understand that a lot of these kids, we know they are disproportionately young people of color, and they are trying to enter a workforce that is already defined by inequities. So also just accept that as a piece of the puzzle. One of the issues we've got to contend with is the fact that we don't have a plan. We're here to talk about building a plan. But know also that we don't even really have a map of all of the resources that we want to pull to the table, either at a statewide level or at a city or town or regional level. So understand that piece. And these challenges have to be at the forefront of not only our public systems, but our private systems, nonprofits, state, city resources. They all have to come together and be around that table together. So the Campaign for Working Connecticut, and this is a little bit of a plug. I hope some of you will get to read the paper that are partners in this effort. This is a 75 partner effort. Some of them are workforce investment boards. Others are workforce-oriented nonprofits. It's a broad partnership. And we came together in 2023 around this same question, which we called at the time Opportunity Youth, but indeed it's Disconnected Youth. And we had a process through which we engaged some of the best players, including Domus, to understand their success, to understand what they identified as challenges. We interviewed young people who were in this disconnected youth population, and we tried to pull together a long-term vision with the data available at the time. And we knew at the time that the Dahlia report would be coming on the horizon, and it did, and we were lucky for that. And that data really underpinned for us a great number of the conclusions that we were able to draw. But we started with who is out there that we can find, talk with them about their success, talk with the people experiencing this, understand how we then get started. So I hope some of you will have a chance to look at that. And what I think we found in the way of starting points are that we really need to understand what we have, for starters. So mapping what's available in the state is a really important starting point. And then we have to target untapped federal funds that we believe could be used more successfully in Connecticut to help leverage more success, more work in this area. We need a shared data platform. We talked about data. It's important. It requires investment. And we also know that there are some places that we should get started with investments now. And some of these are listed here: career-based education and training, very, very important. Youth career navigation and social supports. Again, the same theme of coming together around people in that wraparound fashion to make sure we're meeting all their needs. And subsidized employment to help people get a start in the workforce. These are things we already know works. So there are two pieces of this: pulling the system together, but let's not wait on investments with what does work, right? Let's start building the system, understanding how to pull the pieces together, but let's invest in the things that are working. Let's not wait. So I'll stop there. Thank you very much for the opportunity to speak with you.
All right, I feel like I always have to start it off. So I greatly appreciate that you honed in on collaboration and coordination of services. I know in the city of Torrington, we're only 35,000 in population, but we have so many service providers that are doing the same thing. They're vying for the same pots of money to support their agencies. I did take some of my ARPA money that I received and set it aside to do a feasibility study as to how we do that. How do we get them to coordinate, collaborate, and maybe even co-locate? That's a challenge. How do you recommend that be approached?
So with regard to homelessness, we had tremendous leadership from the federal level. The Federal Department of Housing and Urban Development, which is the primary funder of most work to end homelessness, said, you have to do this if you want our money. That was it. Now, that's a hard message sometimes for people to hear. I ran a small nonprofit. You know, you don't go around looking for somebody to tell you how to do your work. But when you say, this is our mission together, and so let's come together and let's understand what you're best at. What am I best at? What are you best at? And let's all do what we're best at. And then let's come together around each person. And then we each add our piece, right? Let's not compete with each other. Let's try and figure out what you can do best and what I can do best, and let's work together. And what we found is that, and I want to be honest, that can be very threatening at first. But we said, this is something we have to do, right? The funding stream requires it. And once you get going and there's a sense of success, it gets easier because everybody sees that we're achieving what we wanted to achieve. We're helping people. We're seeing positive outcomes. That was the whole goal. And so it does get easier. But, you know, again, it's real work. And that's why you have to fund somebody to be that coordinator, and I think you have to say, we're going to do this on a person-by-person, name-by-name basis. And we're going to meet together every week, and we're going to say, how is Josh doing? What does Josh need? And who at this table can follow up on that and make sure to provide that, and this piece and this piece. And then the next week you come back, and then you say to me, did you do that piece? Where are we on Josh, right? And you keep doing that. And then people get used to a new way to work together. But it's a change, and so that's going to be a challenge. But I think when people see the success, then they get committed to it. That's what I would suggest.
I loved, first of all, what you said about reading from the same sheet of music, because I think that is just a very apt metaphor to a lot of the work that we do in local government and in these fields. If someone's not playing, if somebody loses their timing for even a minute, it all kind of falls apart. But it's extraordinary what can happen when everybody is on time. And I think that, you know, clearly the coordinated access networks have been an example of that. I feel in some ways it's been the exception that's proved the rule. And I guess my question is about United Way as a state contractor. You run many state services for the state. You guys run 2-on-1. Many of your member agencies are contractors who administer state programs. And all of us, I know, hear from our legislators and from our nonprofit providers every year about how they have not seen real increases in their cost of living and in their wages at the nonprofit provider level, that legislators are continually trying to rectify that, but it's been a challenge. And I guess I wonder if you could speak to just the way that state services are administered in Connecticut and to the extent to which, you know, through nonprofits, and the extent to which that's been an obstacle, the extent to which maybe that's been a benefit to achieving these successes. And you know, that's going to be just such a big factor, I think, in all of these issues that we're talking about here.
Yeah, so I think I would start by saying that Connecticut's social service delivery system does rely very heavily on nonprofits to deliver the services. As I think people know. There's a lot that's good in that, and there are studies in Connecticut that have shown that the services provided by nonprofits are often more cost-effective and higher in quality. And so I think we should all be proud of that. And we have some very good collaboration with state partners. I would say it is a challenge to work with budgets that in some cases have not gone up in 10 years. Or more, right? Dollar figures of contracts. You can't deliver the same work product in 2024 and the same volume for a contract that has been level since 2014. And that's the case for some of us and some of our services. So that's a real problem. I think, and I don't think I'm alone at this table, I think that Connecticut has got to make some decisions about investing more in our people. We're seeing cost of living go up. Our ALICE data, which is familiar to many of you, reflects that for families in Connecticut, the cost of basics increased by 18% in the last 2 years alone. That's real. Families struggle with that every day. And one of you asked about poverty. Our perspective on that would be that poverty shatters families. Most of the homeless youth that I got to know came from families that had struggled mightily and fallen apart under the pressures of poverty. So that is, I think, very deeply connected here. It might not be the only issue when we talk about disconnected youth, but it's a big piece of it. So I believe very firmly that we've got to invest more in families in Connecticut, in people generally, but in families in particular. So that would be part of what I think I'd answer.
Lisa, I really appreciate what you've shared, and help us, so take these principles of a coordinated system and apply them to how this crisis would be addressed and how Connecticut could work together to get 60,000 back on track. Should it operate at the state level? Should it be a local level? Who should be in charge? Who's the quarterback? Is it the governor? Is it a mayor? How do you think about applying it to this?
Wow, that's a great question. So I think one thing that probably everyone in this room knows is that Connecticut is very localized. So what might work in Eastern Connecticut is not going to be the same answer for New Haven. But there are general principles, I think, that you can employ here nonetheless. You do need a statewide effort, I would suggest, but you can have a template that can be adjusted. Whether it's maybe at a city level, our cities have very dense populations. They might just need to work on a city level. They might want to work on a regional level. In Eastern Connecticut, where I live, regional cooperation is important. But the key thing is to pull to one table nonprofits, local entities, and their state partners, and to have somebody who is sitting at that table able to be the convener, able to keep everyone on track, and able to be the holder of that by name list of who are the kids we're working with. And frankly, that can be different in different places. In one place, that might be a city entity. In another place, it might be a nonprofit. I think each region, though, or if it's at the city level, you just have to commit to who it's going to be and then get moving. And if you do have slightly different templates, or the same template, but maybe different models that you're building, then you learn from each other. And that's good, too. So I think it kind of has to be all of the above, everybody at that table, and identify the best coordinator who can be there. Yeah.
To build on that, so what's stopping Connecticut from doing that tomorrow? Is it knowledge? Is it will? Is it policy barriers? What's in the way?
It's a great question. I think that probably what stands in the way is that everybody who is already doing a piece of this work is working flat out. And coordination and working differently feels like a whole new task that you're giving them, and that's hard. And again, that's something that I think you can ease if you introduce some new resource in the way of coordination that can help make that a little easier for them. But I do think that everybody's working as hard as they can. That's not the issue. It's how do we ease a transition to working differently?
I'm not seeing anybody else, so I'm going to ask a follow-up. When you talk about creating, it almost feels like an IEP for our homeless. They've left school, now let's do an individualized survival plan. We know that our homeless is also transient. So we might be able to establish these coordinated efforts, a template that each municipality is using. But I almost feel like that also has to be information that gets shared where that individual may relocate.
Yeah, so you're right in some ways, but I would say also one surprising thing about homelessness in Connecticut is that people do tend to actually stay in an area. In fact, many people that I have known who are homeless are loath to leave the city that they know because that city is their home. So in fact, what we found is people don't tend to move around Connecticut as much as you might think. when they experience homelessness. And of course, that you know, for some, you might have a family who has an opportunity to move to a different part of the state to live with relatives, right? That kind of thing happens. And so I think it's critical that you build in the ability to communicate across the state. We did build that into the coordinated homelessness response system so that from one regional team to another, you could hand off or keep working with people. And that's critical. You don't want to start from zero.
I had a quick question.
You are listening to the Municipal Voice on WNHH 103.5 FM. Our third public meeting took place on Wednesday, May 29th at Trumbull Town Hall. The topic of discussion for this event was child welfare and the justice system involvement.
Are currently incarcerated. That includes 51 young people between the age of 14 and 17. When we look over time, dating back to 2015, it is true that in Connecticut, the trend lines are generally good, meaning arrests and incarcerations for young adults are down significantly. But yet we still have significant need. There's still so much more to do, especially for young people who are most disconnected, who are struggling the most. Tonight, again, we're going to hear from multiple perspectives, including law enforcement, about what's happening in communities across this state and what are solutions for how together we can meet the needs of all young folks in Connecticut. Without further ado, I'm super excited to introduce the first panel. The first panel, if I may, I'll introduce the people and their titles, but save the bios because they're available to folks in the audience as well as online, in part so we can save time to hear from them. So Thea Montanez is the newly appointed Senior Advisor for Governor Lamont. I should say that the commission reached out to Thea before she was appointed Senior Advisor to Governor Lamont because of Thea's decades of service. Most recently, her 8 years of service as COO for Mayor Luke Bronin in the city of Hartford. And so we've really have a true expert in Thea in many forms, so thrilled that you're here tonight. To Thea's right is Sarah Egan, the child advocate for the state of Connecticut, another absolute champion for children. And then to her right is Charmise Wolcott, the state's attorney for the Judicial District of Hartford. And thrilled to have you here as well. And at this time, we'll turn to you, and the floor is yours.
Great. Good evening, everyone. I appreciate everybody coming out and being a part of this conversation. And so tonight I'm here to share my experience as the former chief operating officer of my home, the city of Hartford. I was there for 8 years. And so a lot of what I will share with you is informed by that experience. I will also share with you that probably one of the closest people in my life is my cousin, who was 12 years old when he was first arrested in West Hartford for stealing a toy. And he never left the justice system. By the time he was 19, he was convicted to 60 years in prison. And that entire experience broke our family. I'm very happy to report, though, he was recently approved for a sentence modification and was released after 33 years. And so he is 52, and we are slowly trying to help him rebuild his life. But that is why this work for me is so important, because I can't help but think if somebody had helped him when he was 12 years old, would it saved our family 33 years of so much pain. So in my former role as the chief operating officer of the city of Hartford, a big focus is maintaining our infrastructure, right? And so that's everything, from modernizing our flood control system to redesigning trash routes to overseeing renovations and parks and school facilities, right? That's typically what a chief operating officer or town manager does in a city. But, I think given the experience I just shared with my family, I also recognize there was another asset in our city that we needed to spend more time investing in, and that's the human capital that exists in a community. And so I charged myself with trying to figure out what was my role as COO of the city of Hartford to try to support the lives of those persons who may be justice involved, whether they're youth or adults, whether it's persons living with addiction or mental illness or housing instability. And so I spent 8 years partnering with an amazing team at the city of Hartford trying to solve for those issues. So, it just wasn't about improving efficiency and effectiveness. It was also integrating compassion into what we did as local government. And one of the most influential people during my career, during those 8 years, was a little boy who was 11 years old at the time. And he was shot at 3 o'clock in the morning. He survived. but that little boy inspired an entire body of work that then became our youth safety and justice strategy. So I'll tell you a little bit about that little boy who was 11 at the time. He was out. His mother had gone to a wedding and she had left him with friends, and so he went, outside with other friends, and he was shot in the shoulder, and immediately transported to Connecticut Children's. He was released, probably close to about 10 a.m. that morning. And I get a phone call from Mayor Luke Bronin. And Luke had gone to the family's house. He heard about the shooting from the police department, and he wanted to go to the home. And he wanted to understand what he could do to ensure this little boy would no longer, be vulnerable to violence. And so Luke showed up at this apartment building, and he called me that morning. I remember I was making breakfast, and he was calling me because he couldn't get into the apartment building. There was no one to buzz him in. So as he's talking to me, I can hear this little boy, and it's the little boy that was shot, and his arm is in a cast. And so Luke hangs up the phone. The little boy lets him upstairs into the apartment. And so Luke spends time with mom trying to understand what was going on in the household. And as soon as Luke leaves, he calls me and he says, Thea, I met with mom. She doesn't feel safe where they live. She wants to move. And so I decided I was going to stick with that family because I wanted to know what happens when an 11-year-old gets shot. And what I sadly discovered is not a whole lot. Yes, the police respond. Yes, they investigate. Yes, they are required to refer the case to DCF for them to determine whether, the violence was the result of abuse or neglect by the parent. But that's it. And I just, found that hard to believe that was the best that we could do. So I committed myself to staying with that little boy. And so I found out where he went to school, and I called the principal. I started talking to various youth providers, trying to understand if they were familiar with the family. And what I soon discovered was the family had been referred to DCF on multiple occasions. DCF had intervened by recommending they go to various community providers to provide support services. And that little boy was connected to 5 different nonprofit providers. And none of them knew that. And so I decided it made sense that we all get together. So I called a meeting in my office, and I had DCF there, and I had the 5 nonprofit providers there, and I had the school. I invited the school to attend. And we came up with a plan. We assigned the young man and his sibling, in fact, a mentor to work with him. And again, that little boy inspired a protocol that we put in place in the city of Hartford. And so I do have a slide where I can just share with you what that looks like.
You also should have a clicker as well, I think.
I do have a clicker, but that's too far advanced for me. Okay, perfect. Thank you. This little boy inspired this protocol that I'll share, but I will say to you that since we put that protocol in place, and it's been in place for over 6 years in the city of Hartford, there's a couple of things that we've discovered that keep coming up over and over and over again. So currently in the city of Hartford, if you are a victim of violence and you are under the age of 25, we ensure that we do, again, this protocol that I'll explain to you. But what we've discovered through that work is these 3 things. Oftentimes, the victim of violence has a history of school disciplinary issues, they've stopped going to school, and more oftentimes than not, there are special education needs that are not being met. The second issue is that the victim and or family member is known to law enforcement or the Department of Children and Families. And the third is that the victim has previously been referred to a community-based organization and or connected to multiple community-based organizations, just like that little boy that I mentioned who is connected to 5 nonprofit partners. The second slide is, there we go, the protocol, and it's teeny tiny, and I apologize in advance, so I'll just talk you through it. It talks, it just walks, the first step there is the incident of violence that occurs. So there's 2 ways that, our Department of Children and Families becomes aware that a young person is a victim of violence. One is the Hartford Police Department will automatically notify somebody that we have identified as the point of contact within that department, and will give them a high-level overview of what happened. The second person that will also contact the Department of Family is our Hospital Violence Intervention specialist. And so in the city of Hartford, we have funded, the city has funded our 3 hospitals, Hartford Hospital, St. Francis, and Connecticut Children's, to have a full-time person whose sole job it is to go bedside anytime there has been a young person who's been victimized by violence. So that person with PD will notify our Department of Family and Children that somebody has been victimized and we need to initiate the protocol. From there, that person fills out, an initial intake form, gathering all the information that they have access to. And then within 24 hours, they convene a meeting. And that meeting consists of the person at the hospital that was bedside. It also includes a representative from the school district, youth provider who most likely is connected to that youth and their family, and then DCF. And so the point of that call is for everybody to be on the same page in terms of what happened and how do we ensure this does not happen again, but providing whatever intervention that family needs so that it is coordinated. I think, oftentimes people with very good intentions will go to the emergency room to try to provide whatever support, but I have found in speaking with families that is very, very overwhelming. And so the idea is we will simplify that process by at least having one person who that family can work with. And then from there, there are follow-up calls that happen. And, we have seen some success. But, the story I'm going to tell you next is one which is very complex. And it really speaks, I think, to the population, right, that are justice involved that you are focusing on today. And so, this second young person that I'm going to talk about is a 14-year-old boy. So just last year, July 23rd at 3 a.m, he was in a stolen vehicle with his cousin and 2 other young people, and the car was shot. He was not injured. It turns out this little boy was one of 9 siblings. He lived with his mother, who's a single mom. She had just had a newborn baby who I believe was 2 weeks old when the shooting occurred. And her oldest was 17 years old. Multiple children in the house were disabled, including a toddler who had a feeding tube. The family lived in a 3-bedroom apartment. One of the bedrooms was infested with rats, and so they did not use that room. And so really it was a 2-bedroom apartment. And this was this little boy's home. And so, I become aware that he was shot. And so I insert myself into this process that I just laid out, and I have this meeting in my office. And so, we're talking about what we know about the family. And so we ask one of our youth providers to work with the young person and their family. And they have this process, and they're very good at doing it. But I could not stop thinking of this family. And so I kept following up and following up and following up. And every time I would follow up, I would find a new piece of information. And what I discovered about this little boy was he had been expelled from school for violent behavior several months back. He was assigned to alternative education, and he had stopped going at some point. And he did have a criminal history. In fact, he had attacked an elderly person. However, he was not charged. The elderly person chose not to press charges, and it was decided that, he would not be convicted of a crime. So the little boy gets shot on July 23rd, and we get together to come up with a plan. On August 10th, he steals a car in East Hartford. Over a week, on August 19th, so a little over, a week later, he steals a car in Connecticut, gets into a high-speed chase in Massachusetts, evades the police. Eventually they catch him and they find drugs and guns on him and release him to his mother. At this point, I contact DCF and juvenile probation for assistance, because either he is going to be killed or he will kill someone. And so we have a conference call and we talk about what we could potentially do. And because he did not formally was convicted of anything, he wasn't under court supervision. So legally, there was nothing that juvenile probation could do. DCF was aware of the family, and at this point, they had assigned social workers to work with them. And so by this point, now I'm getting calls from the public defenders representing him that are trying to understand how they can help. And to make a long story short, on August 31st, the Hartford Police Department arrests this little boy, along with his 12-year-old brother, for robbing and attacking a man walking home from work. They had robbed him at knife point and had assaulted him. He ends up going to detention along with his 12-year-old brother, and then it turns out a couple of weeks later, the family gets evicted. They're living in multiple hotels. And, I will tell you that at one point I started keeping a list of all the people that were trying to help this family, and it was a total of 22 people, including myself. And it's not because people don't care. There are so many people that care at the state, at the city level, within our nonprofit community. But this is a really complicated issue. I don't think that any of us are really sometimes resourced to deal with. And there is not the discipline and the follow-up and the follow-through and the relentlessness that you have to have when dealing with these issues. And so I will tell you, this little boy, as this is all happening, I was ending my career at City Hall, and I remember just feeling like I was failing. And it was one of the reasons I thought about leaving public service. And I remember talking to a youth provider, and I asked her, how do you keep doing this? I need to understand, I need to know. And she said, I have to know that I tried. And so it's because of that that I decided to continue my career in public service, this time at the state. And so, I'm really hopeful that with all of the people, including many of you in this room who are, working with these young people and the two people beside me, that we'll be able to figure out ways to support families like the young man who I just described to you. So with that, I did have one other slide, and it's just simply to lay out a consideration for the group, right? And so it's this idea of coordinated care. We're supposed to do it in the healthcare system. I think we need to take this same model and apply it to young people that may be justice involved. I firmly believe that young people that are justice involved, may be committing those crimes most likely because it is a manifestation, their behavior is a manifestation of unmet mental health or behavioral health needs. And so I should say this, that, when I was working with the little boy that I just talked to you about, I remember asking the Hartford Police Department, please, here is his address, and I want you to know, have you ever been to their home before? And it turns out that when that little boy was 8 years old, he was walking down the street with his younger brother and his mom, and I think it was his brother's father had approached the mom and had stabbed her with a butter knife. And those two little boys witnessed that. And then it made all the sense in the world. And so, again, I can't help but think, at that moment when that little boy was exposed to that level of trauma and violence, was there an intervention? Had there been a rapid response protocol, would that have made a difference in terms of, the decisions that little boy and that family ended up making? So with that, I'm going to turn it over to my colleagues.
We'd like to thank our commission members, our panelists, and the members of the public who have given testimony. You can RSVP for our next meeting on June 25th at Meriden Town Hall by visiting our website at 119kcommission.org. The Municipal Voice is a co-production by CCM and WNHH 103.5 FM. Christopher Gilson is our producer, Harry Draws is on the boards, and I'm Matt Ford, your host. Be sure to check out our Facebook page and give us a like, and watch out for our CCM chat series on our YouTube page.